Hello, my good people. It's yet another day whereby we continue with our education bangers. And before I start, let me start by appreciating you guys for the continued support you are showing me all through. I always appreciate before each and every video because you people, you are really my family, and what you are doing to me, I never expected it within a short duration. We are at 8.2 thousand subscribers, which is within a short period of time. So guys, let's continue subscribing. Let's encourage our friends, let's encourage our family to subscribe, and I know we are going to succeed as a family. So let's continue with our topic, our discussion of discussion, whereby we have been discussing about STDs, or sexually transmitted infections, or sexually transmitted diseases, sorry. And in this video we are going to discuss about the diagnosis, or how can a healthcare provider or a doctor or a healthcare professional can tell whether you are having an STI, that is a sexually transmitted infection, or you are having a sexually transmitted disease. For those who are following me yesterday, we did clarify the difference between a sexually transmitted infection and a sexually transmitted disease. So, how can a doctor diagnose that you are having a sexually transmitted disease? So, healthcare professional can perform tests and examinations to help figure out whether you are having an STI, or a sexually transmitted infection, or a different condition, because we have so many conditions that can also present with similar signs and symptoms. So the tests include rapid finger prick tests. This is whereby you are pricked in your finger and the blood is taken to go and test. For example, you can test for HIV virus, you can test for hepatitis B. Number two, we have fluid samples. Fluid samples from, for example, from the fluid might be from the vagina, it might be from the penis, and it might be from the anal region, or the anus, or any salts that have appeared. Number three, we have blood tests. Number four, we have urine samples. And obviously in urine samples and blood samples, obviously you are going to test for urinary tract infection in the urine, which can lead to an STD, or a sexually transmitted disease. Because as we discussed yesterday, most of the sexually transmitted disease, the initial stage or the first stage is always a sexually transmitted infection. Then it goes, if left untreated, it turns to be a sexually transmitted disease. Number five, we have pelvic and physical examinations. And there is a point to note here. It's important to get tested regularly if you have or you are sexually active, and consult a healthcare practitioner as soon as you feel or you see some symptoms develop. This simply means if you are sexually active, the young people who can't stay without having sexual intercourse. So if you are sexually active, have regular skin screening or regular testing for you to be diagnosed earlier enough to avoid more complications. I hope you get that point. So if you see an early symptom developing, consult your healthcare practitioner or your doctor, as early diagnosis leads to earlier treatment, and this reduces or decreases risk of complications. So let's discuss about sexually transmitted disease treatment. So sexually transmitted diseases can have varied effects on the body, can have varied or different effects in the body. A number of treatment options depending on the body, depending on the condition, include: number one, antibiotics. Obviously, most of these sexually transmitted diseases are managed by using antibiotics. The antibiotics may be oral or taken through the mouth or intravenous. That means they are injected direct to the vein, or intramuscular. That means they can be injected in the gluteus or in the buttocks. So we have antibiotics, we have oral or topical medication, especially whereby we have the sores or the herpes. It can be applied topically. We have also surgery, like in the case of warts. If they are worse, surgery can be considered to remove the warts. And also laser treatment, of which we discussed about laser treatment when we were discussing about warts. So we have another point to note: life stages, changes or alterations. Lifestyle changes, lifestyle changes, not stages. Lifestyle changes or alterations, such as abstaining from sexual intercourse until treatment is over or complete. That is another way of avoiding or preventing yourself from getting this kind of a disease. That is lifestyle changes, which involves abstaining from sexual intercourse. For example, when you are on treatment, you can avoid sexual intercourse until the treatment is complete or it's over, or the doctor tells you that you are completely healed. Another point to note: with major sexually transmitted diseases, it's impossible to undo the damage that has been caused by this kind of a disease, but some also, such as genital warts and AIDS, cannot be cured or are not curable. So let's discuss about the tips of sexually transmitted disease prevention. So the best way to prevent a sexually transmitted disease is to prevent a sexually transmitted infection. It might look a bit complicated, but in our initial stages of this discussion, we said that most of these sexually transmitted diseases start from a sexually transmitted infection, then it goes to a sexually transmitted disease. So Preventing a sexually transmitted infection will obviously prevent the risk of a sexually transmitted disease or risk of this sexually transmitted infection going to the next stage of being a sexually transmitted disease. Now I hope you understand it. So, the best way to prevent a sexually transmitted disease is to prevent a sexually transmitted infection, and the only foolproof foolproof way to do that is to avoid sexual contact. But there are ways to make safer and reduce risk of contracting STI. There are ways, if you can't abstain from sex, there are ways to make this sex much safer and reduce the risk of contracting the STI. Number one, we have having discussions about sexual history with a new partner. If you get a new partner, have an open discussion about sexual history. For example, he or she might tell you once she had or he had an STI. So you will consider treatment first, testing and treatment first, before you engage in sexual intercourse. So having a discussion about sexual history with a new partner before having sexual activity, and decide if both of you are comfortable with it. If there are some doubts, go to an healthcare provider, get tested, and if you have the STI, get treated before you involve yourself in sexual activity. Number two, getting tested regularly for STIs. Getting tested regularly for STIs, especially if you have multiple sexual partners or if you have a new partner. Number three, using of condoms properly during vaginal, anal, or oral sex to prevent spread through fluids, to prevent spread through body contact of the fluids. Number four, you can use sexual dams when having oral sex. Number five, get vaccinated against human papilloma virus and hepatitis B. And the last point, if at high risk for contracting HIV, think about taking post-exposure prophylaxis medication every day. This marks the end of this discussion about STI diagnosis, prevention, and ways of preventing the risk of contracting this disease. So, thank you guys for your time. I do appreciate the way you are supporting me. Let's continue subscribing, sharing, and liking our videos. And let's meet in the next video. Have a good evening.